Okay, it's preparing. We are ready.
Okay. Good morning, everyone. My name is Cefaan Kim. I'm a reporter with WABC TV Eyewitness News here in New York and a correspondent for ABC News. And we are here for a substantive and hopefully thoughtful and meaningful discussion on this disturbing trend, but also a time to celebrate because it is AAPI History Month, and it is important to take that time to celebrate. There's a lot to be proud of, but I want to thank all of you for first taking the time on this gorgeous day to be inside in front of a computer, to be part of this dialogue, because I always say the first step in getting to a better place is having a discussion. So thank you for joining us. I want to remind you that you can submit questions and be part of this discussion at the Facebook website for MetroPlusHealth. That is facebook.com/MetroPlusHealth. You can put your questions there, and we'll try to get to those throughout this. As you know, this has been alarming to a lot of folks and disturbing. I would say that this is something that is not new to the community. We all know, have lived personal experiences of bias in this country. And so what's new, I think, is that we're finally taking the moment to speak out. And in that speaking out, there is some unity and some hope. So again, I want to focus on the good. There's a lot of good here to discuss. So joining us today is a heavy hitter panel. I want to introduce everyone joining us today. First, we have joining us is Lieutenant Governor Kathy Hochul. Now, the Lieutenant Governor began her career in public service in her local town board before serving as Erie County Clerk, and then as a member of Congress for New York's 26th Congressional District. Since 2015, she has served as the highest ranking female elected official in New York State government. Lieutenant Governor Hochul has successfully spearheaded numerous initiatives and leads administration's economic development and job creation efforts across the state, working every day to advocate for policies and help all New Yorkers make ends meet. She's also a Buffalo Bills fan, but we'll forgive her for that one. We also have with us a panelist, Carmelyn Malalis. She is the chair and commissioner of the New York City Commission on Human Rights. We all know how important that agency is. Commissioner Malalis was appointed chair and commissioner in November 2014, following more than a decade in private practice as an advocate for employees' rights in the workplace. Throughout her career, the commissioner has demonstrated a fierce commitment to promoting diversity and inclusion, so important in this discussion, and preventing and prosecuting discrimination and intolerance. So we'll certainly tap into her knowledge there. She earned her JD from Northwestern University School of Law and received a BA in Women's Studies from Yale University, just a small little school there. She and her wife live in Brooklyn with their 2 children. Also joining us is Christina Seed. She's an AAPI influencer and owner of Chinatown Ice Cream Factory. If you don't like ice cream, something is wrong with you. And if you do like ice cream and you don't know Chinatown Ice Cream Factory, then something is wrong with you. So thank you for joining us, Christina. She has been repeatedly voted the best ice cream in New York City. Obviously, I have no dispute with that. It stands as an unofficial landmark in the community, literally really does. So she blogs about eateries, politics, boutiques, anything and everything Chinatown related. Obviously, community is so impacted over the past year. She serves on committees and boards in NYC. Her generosity and advocacy in Chinatown and the APA community is laudable. She proudly embraces her culture, as we all know, and her community as a 3rd generation Chinese American living out her dreams while working towards making changes in the world. We also have another panelist, Dr. Eric Wei, who's a Senior VP and Chief Quality Officer of NYC Health+Hospitals, a very important position there. He is an associate professor of clinical emergency medicine at NYU Grossman School of Medicine. NYC Health+Hospitals is the largest municipal health system in the US with 11 acute care hospitals, 5 nursing facilities, 60+ community health centers, a home care agency, correctional health services, and an insurance plan, MetroPlusHealth. That's a lot, right? So he has received his bachelor's degree in molecular, cell, and developmental biology at the University of California at Los Angeles. I don't even know what that means. It means you're very, very smart. He completed the combined MD and MBA program at the University of California, Irvine. And Dr. Wei completed his emergency medicine residency and the Health Administration Scholars Program at the University of Michigan. He's a fellow of the American College of Emergency Physicians. Well, we have more. I told you we had a heavy hitter panel. We also have with us to kick off things, President and Chief Executive Officer of Metro Health. We should all be familiar with her, Dr. Talya Schwartz. Dr. Schwartz was appointed President and CEO of MetroPlusHealth in May of 2019. Prior to her appointment, she served as the Chief Medical Officer at MetroPlusHealth, leading the Medical Management Division. Under her leadership, MetroPlusHealth has consistently ranked the top plans in the state for quality. No small achievement there. She transformed the care management program into a holistic, field-based program that now also addresses social determinants of health and special focus on housing for its homeless population. Timely matter in today's current events, obviously. So Dr. Schwartz earned her medical degree from Sackler Medical School, and she's a graduate certificate in health services management and leadership from the George Washington University. She completed her residency in pediatrics at Maimonides Medical Center in Brooklyn, New York, and worked as a pediatrician at Children's National Medical Center in Washington, D.C. You all are so accomplished. I'm out of breath just introducing you all. So now I can take a breath. I'll bring onto the floor Dr. Talya Schwartz.
Thank you, Cefaan. We're really grateful to have you moderating this very timely conversation today. On behalf of everyone at MetroPlusHealth, our 1,300 employees and over 23,000 providers, welcome. There is no place in the city for bias, harassment, or discrimination of any kind. And MetroPlusHealth is proud to stand in solidarity with AAPI communities across the boroughs as we unite against anti-Asian and really all hate. I want to thank our panelists for their partnership and say welcome to our members, over 600,000 New Yorkers, many of whom have joined us today. Today, we will explore ways that all of us can feel safe, protected, and empowered. MetroPlusHealth Plan is more than just a health plan, and our goal is to make our members feel safe and empowered. We do this by addressing the many contributing factors impacting the health of our members, from food insecurity to economic stability to equitable access to quality healthcare, our core business. So as you can see, it was a business and a moral imperative for MetroPlusHealth Plan to create this forum to discuss this challenging issue. We know that like many New York City communities of color, the impact of COVID-19 has disproportionately impacted Asian American New Yorkers. And MetroPlusHealth Plan has built new partnerships and invested in new opportunities to better meet those needs. I am pleased to share one of MetroPlus's health priority investments this year has been a new community office in the heart of Flushing, Queens on Roosevelt Island. The office is still under construction, but it will be opening its doors this summer. So stay tuned for details on the grand opening. And now it gives me great pleasure to introduce a true leader on this issue for all New Yorkers, Lieutenant Governor Kathy Hochul, who will share her remarks. Kathy, thank you so much. The floor is yours.
Well, thank you very much. And to you, Dr. Schwartz, and the entire MetroPlusHealth family, this is such an important conversation to be having. And I thank all the panelists for giving their time and our moderator for bringing us together to have conversations that when you think about it, perhaps should have happened long ago. I think what we've been missing in this country as we try to figure out why there's not more diversity and acceptance of people from different races and cultures and ethnic groups and places around the world. I think there's just been a lack of education starting early in our schools. I don't know that I remember a class on learning the contributions of Asian Americans or what happened in China and the immigrants who came here and helped build our railroads and build our canals and help build the great city of New York, or on the other coast, what happened in California and San Francisco. So I think what we need to do, first of all, is to start changing how we educate kids at a younger age. Let them see, shut it down. My back, sorry about that, little technology. I can't wait till we can do this in person. Stop the Zoom, and we have to have a ban on Zoom. Stop Asian hate, stop Zoom meetings, stop all this. And I think
I'm all for that.
Yeah, that last loss of connectivity perhaps is why things are so exacerbated right now. But my heart tells me that we need to do more on educating people about the contributions of the various ethnic groups that comprise this great fabric of New York. And let's start with the Asian communities. Let's make up for some lost time here. And I say this not just as a statewide official, but also as the aunt of two beautiful teenage girls adopted very young age from China by my sister. One little Sammy, who's a freshman at Penn State, was literally found in a Cabbage Patch, and we call her the original Cabbage Patch baby. And so she's been a joy to our family. But her mother, my sister, and I talk about, what kind of world are these two girls heading into? And the anxiety that my sister feels, what's happening on a college campus in a rural, primarily white community, what is her daughter going to be subjected to? So this is really, it's real, it's personal to me. And that is why for way before this became such a crisis, and we really have had an epidemic phase in this specter known as Asian hate crimes. Even before that, I spent a lot of time reaching out the early days of COVID, going to Flushing, going to the New World Mall and talking to people and seeing business owners were literally crushed and devastated that people somehow were blaming China for the virus and they would not come to their businesses. So I sat there, brought the TV cameras and said, no, this is okay. You can come here. It's safe. Everyone's wearing masks. I did the same thing in Chinatown. And for years, I always participate in all the parades to show that I understand the valuable contributions of the Asian community and let's celebrate their traditions. I just fear that most people don't have that appreciation. Number one, let's start changing that dynamic. Number two, when people are victimized, I don't know that they feel that they have an ecosystem that's going to support them. The 65-year-old, we hear we hear the news that that someone may have captured on video. We see that, but I think there's a lot of other cases that go unreported because of fear in the communities. They're not talking about what happened. There's a shame associated with it. And what's happening is more people are now staying in their homes and not coming out. I've heard this from countless, particularly senior citizens, like they're afraid to go out in their own communities. They're afraid to go out and get vaccines. When I was trying to announce vaccine sites in Chinatown and Flushing, people said they're not going to come out. So that's been a problem for us. But I want more people to be feeling a responsibility, a moral responsibility to these fellow citizens, our neighbors, and not just be a bystander any longer when you see something. I want more cameras to come out. I want more video taking. I want to call this out. People need to be upstanders, not bystanders. Stand up and call it out and shame the people who dare call out someone with a vicious, bigoted phrase or to even physically assault them. We have to stand up and be tough. I mean, we're tough New Yorkers, but how are we going to channel that toughness into a message that says there is no tolerance for this? You don't have a right to do this, and there will be consequences. And if it's a mental health problem, we'll get you the help, but that's not an excuse. You cannot touch another person and make them in fear. That's just wrong. It's not who we are. So we need more education. We need more language translation for emotional support services. Someone who's been assaulted, that's not just a physical wound. That's an emotional wound. That's a scarring. That has now changed their psyche and their confidence and their sense of security. They're going to need some professional to talk to. And that's not culturally the norm because people are strong, they're resilient, they're independent. They don't want to say they need help. We have to break through that so they can lead a healthy life if they have been victimized, and let them know that the state of New York stands with them. Whatever recommendations come out of a panel like this from all these people who bring their different voices and expertise to this, let us know what they are. We're conducting virtual town halls with the Asian community throughout the month, Asian American Appreciation Month. And so we're going to have those conversations, but I don't want to just talk. I'm not just a talker. I'm a doer. Let's get something done. Let's change something. Let's change a policy. Let's change curriculum. Let's change the language barriers that may exist in availing themselves to services for mental health support after a trauma like this. And let's just start changing the hearts and minds of people and let them know that our community is great because of people who've come from other parts of the world. My Irish immigrants, grandparents, I know the story. All of us have made this city great. I'm literally sitting looking out at the Statue of Liberty out my window as we speak. I'm on Staten Island right now. And I think this is part of what makes us so desirable. People want to live here. We have so many Asian businesses that are thriving now because they're hard workers, they're entrepreneurs, but they took a real hit during COVID. We need to step up and support them as well. That's my final message. Get out and support these businesses in the communities. show our love, show our appreciation for what they do, and we'll overcome this together.
Lieutenant Governor Hochul, before you go, I just want to highlight some of the things that you just said because it's so important. You mentioned the mental health component of this, and there's this raging debate about whether we're looking at a mental health issue or a racism issue. And quite frankly, I'm really appreciative that you brought it up that way because the two are not necessarily mutually exclusive. And this is a complicated issue, and we should look at it that way. That's the first thing. And also, I love that you pointed out the fact that we need to sort of revise our history books. It is not a point that's often raised, but it's very important. Anyone who lives and works in Chinatown, like Christina does, for instance, knows of Corky Lee, who is this famed photographer, civil rights photographer, you'd call him, an institution, who passed away, unfortunately. He's a friend of mine, way too early of COVID, early this year. But he got into this because he, as a young high school student, looked in the history books and didn't see a reflection of him, particularly with the railroads. And so one of his biggest projects was he recreated the workers who built those railroads by the generations that followed of those Chinese Americans. And it's a powerful image because the original image sort of just whitewashed, right? And the Chinese workers were on the sidelines and not in that image. And he recaptured that. So I'd like to think on a positive note, before I let you go, that we are sort of rewriting our history right now. So thank you for leading that, being part of it. And thank you for taking time and joining us to kick off this discussion. Thank you, Lieutenant Governor, for being here.
And thank you to everyone at MetroPlusHealth for all you're doing. This is such an important conversation. So signing off, I have to head out to the harbor in a couple of minutes. I will see you again, hopefully in person. Let's do this in person.
Definitely.
Bye-bye.
Thank you so much. All right. So with that being said, let's kick off what is going to be a really, again, meaningful discussion. Let's start with, how we're all doing, right? We can't really escape that. And it'd be a mistake to deny that this moment that we're in has been awfully personal for members of the community. And I think it's personal because it's safe to say that we've all sort of lived this trauma. That's the common theme that I find when I speak to victims after victim after victim, or just members of the community who have been watching this and reading this and living this. Unfortunately, this has been personal because we all have something or some event, multiple events, probably a lifetime of a history of bias that sort of triggers our own trauma. So I always like to start off by asking panelists, what is your earliest memory of confronting and facing bias? Because I think that's an indication of just how personal and deep this is and how this really didn't just start this past year or the past couple of years. This is something we've lived with. I can tell you that one of my earliest memories is as a fourth grader, I had my school teacher openly mock my name in the class and had the entire class collectively laugh at me, right? And at the time, I didn't think much of it, but why do I remember that as a 40-year-old adult? Because clearly that was something that shook me. It's a person in authority who's leading an open humiliation of a student, a child at that, over their name, which is an ethnic sort of humiliation. And in the military, I was in the Army. When I first enlisted, I had been told that in the Army we're all one color, we're green, we're not black, white, or yellow, or brown. And yet I had drill sergeants tell me to go back to China, which is remarkable because I'm born and raised in this country. My parents are Korean American. I voluntarily enlisted to bleed and die for my country. And I'm being told to go back to China. So I know we all have stories like this. Let me start with Christina. Be personal. Let's let our guard down. When I ask you this question, I want you to give me an honest answer. Your first earliest prominent recollection of facing racial bias.
I actually thought about it because I saw it on the lists, and then it brought back a lot of memories. But the earliest one for me was I had never been to the Halloween parade in the city, and it's supposed to be like a fun event for a kid. And it must have been about 4 or 5 because I remember sitting on my dad's friend's shoulders. And as a parent, you always don't want to let your kid out of your sight. And it must have just been a momentary thing, like they might have just turned their backs to me, but some kids spit in my face, and I was so young, and they called me a chink, and I was so young that I didn't even know what they were doing because they just wiped the spit off my face. And I wasn't even upset because I didn't even know what happened. I didn't even know what a chink was, and I didn't even tell my parents. I brought it up to my parents like years later, but then he was surprised that that had happened to me. But it just sticks with you for years because it's just something that I actually never gone to the Halloween parade after that. And that's like my earliest recollection,
I'm sorry that happened to you. I know we have more. Commissioner Malalis, what's your experience with this?
Well, first of all, I just want to say, thank you so much to MetroPlus for putting this together. We need more of these types of venues, programs, and events. So I want to first say thank you for doing this. Cefaan, I think that this is such a great question just because how striking it's been lately. I'm sure we're all going to share right now, but in the past year, just hearing how many similar stories that I share with my AAPI brothers, sisters, and others, right? Where we're talking about very similar experiences. So even with what Christina just said, I think about, when I was in elementary school and, when children get into arguments or in squabbles, as they often do in elementary school, I knew that when that happened with me, they wouldn't call me like a jerk, or they wouldn't call me kind of the other names that were reserved for the other kids, right? When things like that would happen, it would somehow devolve into attacks on my identity with things like calling me Ching Chong, or things like calling me Chink, or slanting their eyes. When I talk to children these days about the events that they go through at school when we're talking about anti-Asian bullying, such similar stories, right? So Christina, when you said, the name calling and kind of wondering what was happening to you, I think my experience was similar in terms of, the anti-Asian names that we were called. But for me, it was almost, I grew up in a small blue collar town in New Jersey where it was primarily Irish, Italian, and Polish. They had no idea what I was. They had no idea what to make of me. So with regularity, when things would get into squabbles or issues between kids, that was just something I expected, like clockwork.
Yeah, I'm glad you kind of brought up the fact that, when you talk to kids today, they're hearing the same things, right? So this kind of reinforces my point. This is not new, and it's not really gone nowhere, gotten better. So that's perhaps the unfortunate part of this, that our kids are now living the same history that we lived, unfortunately, and let's hope to change that. So Dr. Wei, I'd love to hear from you as well.
Thank you, Cefaan. Yeah, I think this has been a really painful sort of exercise to think back, all the things that I've tried to suppress. And it similarly goes back to elementary school. Grew up in Northern California in Chico, predominantly white, only a few Asian families in the entire town. And I remember, friends calling out my friend, or other kids calling out my friends and saying, why are you sharing your candy or your snacks with that chink, right? And, I as much as it, I didn't really understand, why they were singling me out. I also remember my friends standing up for me, right? And making me, being a voice, a collective voice to say that's not okay. But similarly, memories of walking into restaurants on trips with my immediate family, or be visiting my aunt and uncle in Florida and going on a road trip and walking into restaurants and everyone stopping what they were doing and staring at us like they've never seen an Asian person before, and making it very clear that we were not welcome there. I also, one thing that really stands out from my childhood is the first time I created a resume to apply for a job. I probably had my entire name on there, Eric Kaihuan Wei. And the first person I had review it was my mother. She was a professor. My parents had come for grad school to America, not a atypical, Asian American story for my family. But my mom actually recommended I not list my middle name and just use the initial K. And so now reflecting back, like, what was my mom's experience, having an Asian name? Was my dad's experience that they would actually, and it was a name, my Chinese name was given to me by my father's mother, my paternal grandmother. And so I knew that it was a lot of pride and very meaningful to them, but, fear of me not getting a job because I have my full middle name, at the top of my resume. I just followed it then, but now reflecting back, like what kind of experience must my parents have had, right, to even make that recommendation?
And that's unfortunately a story you hear way too often, right? And then I think about as an adult now, like how traumatic that was for our parents to have to use that as a survival mechanism in some ways. I think about, and I think this is a story everyone can relate to. We've all had that incident where you take your school lunch and it smells different and looks different, and you're embarrassed and you're humiliated, and you go home and tell your mom, don't ever make that for me again, right? And I remember, as an adult, apologizing to her, realizing that what must have made her feel like that the one thing she wanted to be proud of and pass down to her son was his culture, and it's being rejected, right? Because he goes to school and his peers just humiliate him for that. And so that's an issue, right? Dr. Schwartz, I'm going to rephrase the question to you, because obviously I don't think that you've heard racial bias directly in your face, but I like to always ask this question to folks, right? What was the moment, if you can remember, where you first became acutely aware that this is a problem? Because a lot of folks, even within the AAPI community, we're not aware that this bias is an ongoing thing and it's a problem. We don't all live, as we say, this monolithic experience, right? This has been eye-opening for many people in this moment, but I'm curious for you, when did you first see that this is a serious problem, and what was that moment that opened your eyes to it?
Yeah, so frankly, being from a Jewish descent, I'm not completely foreign to the concept of discrimination. I can tell you that different type of discrimination, but it's coming from the same place. I remember when my family was getting ready to leave the former Soviet Union and immigrate to Israel. I remember the teacher saying to me, "I can't wait for your dirty Jew to leave our school." So it's really unfortunate. It's really unfortunate how prevalent discrimination and hatred against somebody who perceived to be different is prevalent everywhere. And you were talking about your name, Eric. My daughter goes to a very diverse school. There are a lot of Asian American kids there, and they all changed their names. They're all Helens and Jimmy and et cetera. And that's not, I see the list, right? I see the list of students and I see their names. That's not what the name they go by. So to your specific question, I have to say, the awareness was there. I think what really raised it to the top and why we really wanted to push for this conversation is not the awareness that it exists. It's to see how people are responding or not responding to it, right? The bystanders, right? The people who are watching what is happening and not taking action and not saying anything. Partially because they're fearing for their own safety, and I understand that. But partially because I think there is the sentiment of that's not my problem. And I think that is that's a misconception to put it gently. It is everybody's problem. What's happening here is everybody's problem. People do not feel safe in New York City. It's everybody's problem. So, our push is really, let's not be, what you said, let's not be bystanders. There are people with mental health issues. There are people with criminal backgrounds. We understand that. They're the minority. We are the majority, and we can make a difference by standing up and not just watching what's happening.
So many important things you said there. Next year, you're going to moderate this, because that was like every point that I wanted to make. And I love that you addressed it head on, that it's really about how we respond to this. So that is a perfect segue into my next question, and I'll go back to Christina and try to stay in this order. I want to ask you how your organization has been impacted by this issue and what ways you've addressed it, the needs of your staff and community. In fact, what does your staff tell you? What does your community tell you?
So I have 3 locations: Chinatown, Flushing, and Lower East Side. So those are all communities where it's primarily Asian. So a lot of times, especially in the beginning of the pandemic, a lot of people that take out things on our community that are looking to target Asians, because those are primarily Asian communities. We've been pretty fortunate, though, I have to say. I think our community has really come together. I think our local precincts have actually made us feel very safe during this pandemic. Feel very fortunate. And we have a neighborhood block watch, which I think has really helped. I think banding together as a community. And it's been kind of like a fun project that we're now raising funds to support other AAPI organizations. We're starting, like, I don't know if you can see my shirt, the Stop the Asian Hate shirts and buttons and whatnot. So now as a staff, like all of our staff has kind of come together because we're raising 100% of proceeds is going to CPC. Before it was the Federation, but they were really excited to kind of bond together. It's been kind of a team building experience and kind of our own community as our staff, because I think mostly all of our staff right now is Asian, that, you know, having that conversation, and even not our non-Asian staff having that conversation of how to come together. Do you feel safe? Or what has happened to you that makes, you know, stories. Like, it's been kind of a bonding experience out of this terrible time.
Yeah, no, I'm glad you mentioned that, because again, I want to always kind of highlight the positive, and there has been this unifying effect, right? I mean, part of it is because we've all experienced this in some kind of way, and perhaps a lot of us have never talked about it. And just having the conversation out loud has been therapeutic in some sense, and it feels unifying, right? And I also think this moment is so unique in that in the history of the AAPI community here, whether it's the Chinese Exclusion Act, the Japanese internment, or the LA riots, you never really saw across, you know, the very broad, diverse AAPI communities stand together in this kind of way. And, you know, in this unifying fear where all of a sudden, doesn't matter if you're Chinese, Japanese, Filipino, Korean, it's all go back to China and then some kind of violent attack, right? And so we all sort of feel like we are equally under threat. And I think the flip side of that is we've unified as one. And I always kind of want to, again, focus on the fact that, like, in this terrible moment of evil, there's been a lot of good that's come out of that. So I'm glad that you kind of highlighted that. Commissioner, the same question to you about your organization. How's it been impacted? How do you address the needs of your staff and community? What did they tell you?
Sure. Well, so folks that may not know, so I run the city agency called the New York City Commission on Human Rights, and we are the city agency that enforces all of the anti-discrimination protections across New York City. So anywhere you live, breathe, work, exist in our city, you're protected by what is nationally considered to be one of the strongest, you know, anti-harassment, anti-discrimination laws that exists. But really, in order for our law to have impact, we need to be working with community. People know that they have to know that they can report discrimination or harassment to us, that they could call us to do workshops and other events in their area, and that there is this area of government that's going to be responsive to some of the things that are happening in their communities. You know, we have a civil law enforcement mandate so that people can file claims of discrimination or harassment if they occur in employment or housing or places of public accommodation, or some of the things that we're seeing out here on the streets, right? And that's certainly very important because we have the ability to award money damages, other damages, restorative relief. We can order civil penalties in order to deter future acts, but we also do a lot of work in community. And I think for a city like New York City, with its great diversity, that is also incredibly important. Being in community to show that there are public visible shows of support, especially when we see that particular communities are under attack. You know, and going back this past year plus, we certainly have seen that with a lot of our Asian communities, including, I think in the very beginning, even before COVID really took effect here in New York City, we saw in January, as early as January, February, that our Asian business districts, like Chinatown, like our areas in Flushing, et cetera, were being affected. Christina saw my staff out there. We were out quite a bit in those spaces, reminding people that one, this isn't new. The tactics of dividing communities, the tactics of scapegoating specific communities at times of crisis or pandemic, historically, that is not new. What we have to do is we have to pick a different way forward and realize what's happening, so that even if, at the time people heard our then president calling things like the China virus and looking to scapegoat certain communities, that we as New Yorkers have to really resist that, right? Unfortunately, though, as we've seen in the past year, there was quite an increase in anti-Asian hate and violence. My agency looks at things much broader than hate crimes. So hate crimes are something that is attended to by NYPD and by the different district attorneys' offices, because they're looking at criminal activity. We're looking at a very broad set. We're looking at all anti-Asian bias, all anti-Asian hate related. And just in the past year, we saw a 7-fold increase happening throughout New York City in these different areas. So we put together a COVID-19 response team that included specifically looking at anti-Asian hate and violence, expediting those cases. We made sure that we were addressing these things head on without even having to go into litigation. So our response team, we attended to something like almost 200 incidents where we were either directly intervening or educating different entities to make sure acts of discrimination or harassment stopped. In other areas, we created bystander intervention trainings with some of our community partners that were in language. So we've done bystander intervention trainings with the Center for Anti-Violence Education in English, Korean, Mandarin. We just launched a new one in Spanish, and we're looking to expand those languages. And then we also worked with NYPD and district attorneys' offices to do different types of in-language town halls, so that people in New York City understood what's the difference between a hate crime and an act of discrimination. Who can you report to? How does that work? What are the differences in outcome and what you can expect? And we did those in several languages: Tagalog, Mandarin, Korean, Japanese, because we wanted to make sure, that we were not being thwarted by barriers like language barriers. Because here in New York City, it's so important that if people are experiencing discrimination or harassment, something that is so personal and so traumatizing, that they're able to communicate to us in the ways that are most familiar and most understandable. And then finally, I will just say, I hope people have seen around the city, we launched a public art campaign, I Still Believe in Our City. We were very fortunate that we worked with our public artist in residence, Amanda Pingbody-Pakia. We wanted to make sure, again, that there were visible public signs that not just called out the sorts of things that our AAPI communities and individuals have had to weather, like being scapegoated or being called a virus or things of this nature, but also that we were showing that we are resilient. Our communities have been resilient. And we've also been standing and talking about solidarity. We've been standing in solidarity, not just with each other in different AAPI communities, but we've also been standing in solidarity with Black communities, because this has also been, I think, a very important time in the movement for Black lives.
I'm glad you sort of pointed out how your office is so much broader than the criminal category, because I often make the argument that, while the most sensational and the most unfortunately violent incidents get all the attention, I make the argument the other stuff, the spaces that you have to be investigating, is far more dangerous because it's systemic and baked in. And in some ways, I make the argument that the systemic bias is what trickles down to the folks that are struggling with mental illness, because obviously they don't have the capacity to sort of unpack this, and it starts really in the systemic way before it sort of shows itself, if you will, when you see it on the streets. So I appreciate that you brought that up. I have a follow-up question for you, because it's really interesting to me. I have been, for the longest time in my career, for 20 years since the beginning of it, been covering these stories, and have always had the difficulty in getting victims to speak out, right? We're not trained to wear pain and trauma publicly, right? That's a thing. And we're also not trained to necessarily make noise and raise our hand, right?
In many of our communities, Their immigration story is in fact the narrative of escaping oppressive governments, right? So
Right.
people are accustomed also in some spaces to the idea that if they actually report something to government, it makes them even more vulnerable.
Right, and that's a double-edged sword for you guys. So my question is this: I have found in this moment in this coverage that for the first time, the victim's mentality has shifted dramatically, and I can tell you firsthand, each and every one of them have told me that I wouldn't have done this before, except now I feel less alone because so many of us are speaking out, and now I understand the bigger picture and why it's so important. So there's so many things that your office has done, and that's amazing. But my question to you is, do you sense on the ground in the community that mentality is shifting, like the fear of reporting things to your office? Is that changing now?
I think it is, in some way just looking at the numbers, right? So we had over 200 reports of anti-Asian discrimination and harassment come in 2020. If I look at the numbers just from 2021, we already have almost 80 such reports, right? So people are coming in, and I think importantly, they're also coming in other languages, which is incredibly important, and that is also why government has to be responsive in different languages. When I first came into my agency in 2015, I think we had something like 9 languages spoken across our agency. We now have over 30. It is a huge barrier for people to overcome when, there's the initial barrier of, do I even come and report what has happened to me? Will someone believe me? Is it worth it? Will I become more vulnerable for that? Then after overcoming it, just feeling that they can be themselves in talking about it, that they can truly explain in the most comfortable, familiar way possible, the different ways that they've been traumatized or affected by that. So I do think that there has been a change, but I also know that we still have a long way to go, because there's still a lot to overcome.
100%. I would even say there's an initial barrier to your initial barrier, which is a lot of times members of the community don't even realize what's happening is wrong, right?
Yeah.
It's so baked in, it's so normalized that I've seen people get attacked and called names and racial slurs, and they just move on as if that's okay, and that's another barrier to overcome.
Well, it's the normalization, and that's exactly it. The normalization of this type of hate. This is something where for some people, they don't even realize it's a form of racism because they're so accustomed to it.
Because we grew up with it from such a young age.
Yes. I mean, and I have to say this before we move on. If people do experience discrimination or harassment in New York City, please call the New York City Commission on Human Rights, 212-416-0197. Report it, www.nyc.gov/report discrimination. We also have a page on Stop Asian Hate. There's many ways you could contact us. And if we're not the agency you want to talk to, we will help connect you. But you have to know that there is a government agency that is here for you and is on your side.
Such an important resource. Thank you so much. Dr. Wei, same question to you. How has your organization been impacted by it? What does your staff and community tell you?
Yeah, and as a Lieutenant Governor, and you, Cefaan, had mentioned earlier, right, the history of Asian Americans and their contributions to this country, we don't have to look back very far to say last March, right? Our Asian American healthcare heroes left their families and their homes and put their own health at risk to come into hospitals such as where I am right now at Elmhurst, right? The epicenter of last spring in this pandemic. And many of my colleagues, physicians, nurses that were there in the EDs, in our ICUs, receiving patients, doing their best to save lives. Many laid down their own lives in sacrifice. And it just breaks my heart that not only do we have a mental health crisis, a trauma crisis of all of our healthcare heroes, but now we're adding on the events of last summer, George Floyd's death, Black Lives Matter, civil unrest, and now this rash of anti-AAPI hate. This is how we're rewarding our healthcare heroes. And so our nurses, our doctors, our support staff, they're hurting, right? They're shaking, thinking about walking to the subway, taking the subway, walking from the subway station to the hospital or to the clinic, to our nursing home. And we hear it. We're doing many town halls such as this one, letting people speak their truth, getting out there, giving people a voice, and letting them know that we're there with them. We have a Helping Healers Heal program here. The whole idea is to support healthcare workers through emotional and psychological trauma. We are utilizing our 18H3 teams to provide support, debriefs, one-on-one, group debriefs, escalating if they want to speak to a clinical mental health expert like a social worker, psychologist, psychiatrist, really trying to match our staff with the resources that are available to them. I think we have the best mission, the largest safety net healthcare system in the country. We serve 1.1 million New Yorkers. The reason we're hit so hard is because we're serving these populations that were disproportionately affected by COVID and the public health measures of the lockdown. We can hide behind our mission. We can hide behind the fact that we're 80% minority and mostly female employees, but that's not good enough. And so we've had a reckoning ourselves as an organization, how we can learn, how we can be better and be better.
Yep.
And so we are working on ingraining equity, racial and social equity into everything that we do. We've added to our strategic pyramid as a foundation, into our vision statement, ingraining it into all of our performance improvement, quality improvement work, how we review cases. There's now at our board meeting a standing prompt of, for this adverse event or bad case, discuss bias, discuss structural inequities that contributed to this case. We want to be honest with ourselves, right? Bias exists in all of us. And so I think that is allowing us to channel something that's very negative coming out of a very negative pandemic into something positive of how we can grow and be better.
Yeah, unfortunately, I have literally lost count of the number of healthcare workers who've been attacked. I've lost count. I mean, nurses and doctors. By the way, this isn't new personal level. My mother was a nurse for 40 years. And I remember as a young kid in the 80s in Philadelphia, where I was born and raised, she was working the night shift. And she had a bad day, I could tell. And she told me that she had a patient on his deathbed who told her, "I don't want a chink touching my blood." He was dying and didn't want her touching him. So this is baked in. It's not new. And I'm sorry to hear that it's repeating itself. Dr. Schwartz, same question to you. Your organization has been impacted. What does your staff and community tell you?
Yeah, not dissimilar from what Eric just described. Again, people are afraid to come to the office. We're slowly trying to get back to kind of normal or some semblance of normalcy, asking people to come back to the offices, come back and see patients in the community. And there is a lot of fear, which is completely understandable. To go back to what Lieutenant Governor was saying, it's all about action. So the action we are taking, as I mentioned, we decided to open a new community office in Flushing, to have, MetroPlus presence in the community, to kind of put our money where our words are, recruit people from the community to work in the office or to work for MetroPlus. We specifically are looking now to increase our employees who are of Asian descent. The commissioner was talking about languages. We speak, again, upwards of 40 different languages to make sure that people are truly understood. And then, frankly, from just a health coverage perspective, we know that the Asian community was disproportionately impacted by the economic hit. And so specifically going into the Asian communities and making sure that lack of access to healthcare is not complicating things further. They're complicated and challenging as it is. This should not be something that people worry about. So really going into communities where we had less presence before, to be completely transparent, identifying those in the neighborhoods and being proactive about making sure that the challenges are not further complicated by lack of access, lack of preventative care, lack of maintenance care, and then complications that stem from that. So it's really both on the inside, recruiting more people, on kind of in terms of presence and in terms of making sure that eligible New Yorkers have the coverage that they need.
And, can I point out that Flushing location does focus on food insecurity, and this is I think it's an issue that has to be tied in. I want to ask you about this. One of the things that I've been trying to highlight in my coverage for years now is the poverty level in the community. It's this model minority stereotype it's a myth, right? 4 years ago, the numbers from the city, from the mayor's office showed that Asian Americans had the highest level of poverty of any ethnic group in the city at 24%. That's nearly 1 in 4. It's gotten a little bit better since then. I think it's about 21+%. It's not a good thing though. If you look at so many of these victims, the elderly have been attacked. They were out there collecting cans to put food on the table. So let's not forget that part of the narrative, right? They're out here vulnerable and they're having hunger issues. And so my question to you is, it's really important to sort of tie in the food insecurity part of this equation, because so much of the issues are connected, right? Living under the poverty line does and can contribute to mental health. How did your organization see that connection, and how do you approach it in that sort of holistic way?
Yeah. So you're absolutely right. And in general, MetroPlus caters towards vulnerable populations. And so it has been clear, not just to us, but to the entire industry, that only focusing on the clinical and medical conditions is not enough. And so we have been methodically approaching kind of all of the social determinants of health. And obviously food security is a huge component of it. We have a dedicated unit that focuses only on those needs. We have a dedicated unit that focuses on housing needs, anywhere from identifying the people who need support, to doing the application, to going for interviews, to placing people in housing, and then making sure that they stay. And then outside of housing, we have an entire unit that's dedicated to all the other aspects, including food insecurity. I mean, the lucky part of being in New York City is that there are a lot of resources. The problem is that these specific communities are not aware and
Right.
don't know how to access, right? And even if they access, it's not sustainable. And we do a lot of food drives all the time, but that's not enough, right? We can give somebody a bag of food. It's a nice gesture, but that's not sustainable. So while we're doing food drives, we are constantly connecting people to the resources that are available, and then making sure that they're not just referred, but actually connected to the resource and getting the support that they need.
I think this is really important. So I'm going to bring the commissioner on this as well. Food insecurity, there's things that your office is doing as well, I would imagine, right?
Well, even broader than that, one of the things I wanted to mention is that, how harmful the model minority myth has been to our communities, because it creates a false narrative of the realities of, frankly, most of the AAPI families. And even if you look at our city, so in New York City, between 2000 and 2016, there was a 44% increase of Asian families moving into poverty. That was pre-pandemic.
Yep.
And if you realize that most of the people who were living in poverty at that time period were in the nail salon industry, the restaurant industry, food delivery, just imagine what it is like, what the stats are going to be like now. Those specific industries, how hard hit were they during the pandemic?
Yeah.
And what numbers are we going to see moving out? And I say this because as we think about recovery, as we think about where we're supporting different communities, we've got to think about that. We have got to think about that, and who particularly, and in what industries people have been affected.
I'm glad you raised that, because when I did an updated version of this poverty story this year, the latest numbers that we had was from 2018, 2019's numbers I think just came out. And I mentioned in that piece, just imagine what 2020's numbers are, because it's going to be devastating. I'm almost afraid to look at it, to be honest. And we need to be prepared for that.
Exactly.
In a couple of minutes, we're going to open this up to the floor for Q&A. So if you have any questions, please send them in so that we can get to that. In the meantime, I'm going to come back to Christina, because I do want to really sort of make this connection between poverty, mental health, all of that. You're embedded in the community in Chinatown. I've seen it. You know, I'm there a lot, but you're there obviously more often. The mental health aspect of this, it's not just about the assailants, right? I mean, we've sort of touched on this throughout this conversation. The community itself is suffering. I mean, everyone's suffering from this because of COVID, the pandemic, the shutdown, but particularly so in Chinatown. Talk to me about on the ground, what you've seen over the past year in terms of mental health, in terms of poverty. It's pretty visible, don't you think? I mean, what are you noticing over the past year?
Well, in terms of mental health, I think people first dealing with the pandemic, dealing with people being scared, calling us a China virus, then being isolated, kids not going to school. I'm just really happy at this point now, actually seeing kids come out in our community now that people are vaccinated. There's been long lines for food. Like the lines are like tremendous to get a free meal. I just can't imagine like waiting on a line that long to just get food every day. And that's really been the trend in our community. And so many businesses being closed for so long. I mean, our store has been in business for, I think it's 45 years now. So we've seen 9/11, we've seen Hurricane Sandy, we've seen quite a few disasters, but none like how we've been dealing with the pandemic. A lot of people being isolated. So many of my friends have had family members or that have passed away, not being able to properly mourn, seniors being isolated, children being very scared to come out, dealing with unemployment, just a whole myriad of problems. But as like a community on the ground for like businesses, I've seen so many of my like neighborhood shops go out, and that's like my family, because we're essentially like the small businesses are kind of the heart of the community. And when you were saying about how people don't think that we're a community that needs money, I think there's so many different grants that I've applied for, but I know specifically there was one, I think that was a storefront grant, where our zip code was not considered eligible for that grant because they lumped us together with Soho and Tribeca. If our zip code is not Chinatown, what is Chinatown? And all of my fellow businesses are closed. I think we should be eligible for that grant for sure.
Chinatown has been through so much. I have to ask you, does Chinatown survive this?
I think we always find a way of surviving in some shape or form, but it's going to look very different, unfortunately. But
Different in what kind of way, you think?
the businesses won't be the same. I think a lot of the storefronts, the vacant storefronts, it's just gentrification in general in the city. I think a lot of people like a lot of the places that prepare duck or the heavy preparation, like a lot of our Chinese restaurants, a lot of them, I think there will be done and they'll be replaced by something else.
Well, it's a never-changing city. Hopefully that Chinatown can be part of that change. And so I want to sort of pivot to looking ahead, look at some hope, developments that we can sort of be hopeful about. Let me sort of mix up the order here to get a little different voices here. Dr. Wei, let me start with you on this one. Give us some reason to feel good. Where are we going with this?
So I think, right, we've been looking for light at the end of the tunnel for something to give us a little bit of hope. And, I think we're just scratching the surface on how this pandemic, the civil unrest around racial inequity and injustice and anti-Asian hate, vaccines have given me a lot of hope. They're working better than anyone's wildest dreams in terms of being vaccinated is essentially, 100% preventing death from COVID and almost 100% hospitalization. I think bumpy start to vaccine rollout, but now we're doing 12 to 15-year-olds, and I'm hoping as a father of 3 young children, 1, 4, and 6, that as soon as September, we may be doing everyone, right? And so I think, finally allowing myself to have some cautious optimism and hope. I know heartbreaking, just like everything else, even the vaccine access and rollout has had disparities across different minority groups, and everything that we're doing with our vaccine sites and making sure our patients are vaccinated is to fight that disparity. But I do think, our new normal is around the corner, and then we need to not go back to 2019 and just pretend like the last year and a half didn't happen. We need to grow as a country, as a city, as a state, and be better because of all the things that have happened.
Yeah, no kidding. Reminder again, if you have questions in the audience, if you could send them, and then if someone could put that in that chat so I can get to them. But let me go back around the table here. Dr. Schwartz, and I'll come to the commissioner next on this. Again, any reason for hope, like new developments you're seeing in this moment, looking ahead?
Yeah, I mean, I join Eric and the optimism, obviously, around the vaccine. There's still room for improvement. And we're specifically seeing this, again, kind of as catering to more vulnerable New Yorkers, mostly minorities, really trying to pull our weight in making sure that people have access to the vaccine, which is now not an issue. The current issue is really still hesitancy. So not so much I can't get an appointment anymore, but more I'm worried about this. So really seeing us working with City Hall, and obviously working with Health+Hospitals and the community providers to make sure that the populations that were hardest hit now have also the lowest immunization rates, that we are able to put into place any kind of, whether it's education, whether it's access, whether it's incentives, really whatever it takes to increase the rates of immunization so people could go back to normal. I think the other part, Christina talked about kids, right? So kids going back to school in September, that gives, I think, a lot of people some relief and hope of more normalcy. And the last part is, this year, as horrendously difficult as it was, actually pushed a lot of us in kind of public positions, I think, to be more efficient and really use technology in a way that benefits the people we serve. So I absolutely see an opportunity to continue using the technology bump, right, that happened because of necessity, to serve communities. So telemedicine became the norm, more access to mental health. We're seeing a significant uptick in the need for mental health. We also see a significant uptick in using telemedicine for mental health issues. So I'm really hopeful that the silver lining out of all of this, that some of the advancements that we saw, the push of the population to address not just all of the racial issues we're talking about, but also the mental health issues, it's becoming more of a norm. It's something that we can talk about. And now there's also an easier access to that's widely available. So that gives me hope.
That gives me hope too. We definitely have some questions now from Facebook, but I want to let the commissioner jump in on this. Developments that are new in the community that give you some hope.
Government absolutely has to support communities, number one. period. And that is 100% true. I have to say though, it has been, it's been heroic how communities have been coming together in the same way that Christina was talking about earlier. Communities have been coming together to support each other in ways that, like I said, are heroic. The kind of the mutual aid networks that have sprung up, whether it's to address food insecurity, to address other economic issues, the fascinating discussions I think that are taking place regarding community safety. People are taking it upon themselves to reimagine, to have the conversations, to challenge government as to like, what does community safety really look like? What does sustainable long-term safety in our spaces look like? What does it really mean to address hate at its core, to address violence at its core? And how do we prevent that from happening in our communities? And also, how do we not only, of course, turn to government agencies like mine, agencies like the NYPD in order to address that, but also how do we address that inward in our own community spaces? Something that I think that is fascinating, that's been a part of the developments of the past year, is that, we have a mayoral primary coming up. We have many primaries actually coming up in New York City in, just a little bit over a month. And some of these questions now are par for the course for all of the candidates. Questions that I think in the past would have been considered radical are now for every candidate to talk about.
Yeah.
And it's because community is showing their strength and support for each other.
That's a really good point. I mean, it's hard to ignore that. It really, it's become standard, which is like something to be hopeful about, right? So here's a question from Facebook. The question is, and I'm going to start hopefully in the same order again with Christina as a thing about this. What role has social media played in this issue? And how can it be used to bond communities together on moving forward? I would also add to that, how has it divided us, right? Because social media has done both. Christina, let me start with you. Social media's role uniting and dividing in this moment.
I think I really liked some of the Chinatown fan pages, and I follow social media in the sense that a lot of people like post things that are helpful. This event is going on in Columbus Park. They're teaching self-defense. Do you need, and because people see that I'm working in Chinatown, a lot of my friends have also reached out to me because it's kind of hard to update each other during the pandemic. Do you have enough PPE? Do you need this? Do you need that? And then reaching out to your neighbors. So I think social media helps to see what other people are doing in different spaces and staying connected, because pandemic, you're not seeing people really. So we forget about that. But then I think I'm also wary of the way that social media is portraying things too, because I have young kids. I have a 4-year-old and 8-year-old, and I'm kind of cautious of how to have this conversation with them about Asian hate because they're Filipino Chinese. So I want them to understand that these things happen, but I also don't want them to see what I've been seeing on social media, because I also don't want them to feel like everyone's going to hate you because you're Asian. It's like a very sensitive way to communicate with them. So I feel like a lot of social media is also making people so scared, even as adults, that I don't know. I think a lot of media outlets have obviously contacted me during the pandemic and with Asian hate. And I think some of them wanted to paint this picture for me, and I refused to have the picture painted. I'm cautious of going out, but I don't want to feel so scared that I'm scared to live my life.
Yeah.
And I think it's bad because some incidents are happening. I think we need to be progressive about how to stop these things from happening in our community, be proactive about it. But I think to feel like you have to stay in for forever and live in fear, I think that's a bad way to live.
No, that's a good point. I mean, it's so easy to look at social media and think that's a reflection of reality, but it's really not, right? It's the noisiest, sometimes the ugliest, and it's a good reminder. Let me quickly, with the couple of minutes we have left, go around the table again. Social media, Dr. Wei, I'll come to you next. How has social media, you think, in this moment been used?
Yeah, I would agree with Christina. I mean, I think it's a powerful tool to amplify the voices, right? Having prominent Asian Americans being able to speak up and have that amplified, have that community, that feeling of you're not alone in this. But some of these comment threads and sections, very ugly, as you mentioned, and very divisive, and frankly, a lot of just purely racist things being spewed, even around kind of promoting panels like this. People are posting anti-China, anti-Asian comments and thoughts on it. And so that's very difficult to see. And just like Christina, I look at my children's faces, 4 6-year-old daughters and 1-year-old son, and right, they're mixed Taiwanese, Persian, and it's hard for me to even fathom that people aren't born inherently good, and most people are very good, and we need to tap into that. And hate is something that is taught. Hate is something from the environment, and it is a very challenging conversation to have for your kids. And I know it's right, sometimes easier to hide that my kids are too young for that. My boss, the president CEO of Health+Hospitals, he adopted 2 children from Vietnam, and his 14-year-old daughter asked him, why do people hate me? Right. And just imagine how heartbreaking that is, to have your Asian daughter ask you why people hate her just because of who she is.
1,000%. It is taught. Anyone with young kids knows that. You take my daughter to the playground, she doesn't care about who she's playing with. It's taught. A couple of minutes left. We're going to go a little bit over, but let's make it quick if we can. I'm coming to Dr. Schwartz and then the commissioner next on the social media. How do you view how this has impacted this moment?
Yeah, so really quickly, it's a powerful tool, right? We saw it with the former president. You can get to a lot of people and you can use it in a positive way, and you can certainly use it in a negative way. My sense is we need to feed more of the positive messages, just to outweigh all of the negativity. I think, individual conversations on social media are important. Very frequently, they become too personal and not particularly informative. So I think the more we can help with the conversation, stay on track, talk about big issues, not necessarily kind of derailing into personal commentary, but really focusing on what are we trying to achieve, what are we trying to promote, what are we trying to protect here. The more positive messages all of us and others can feed into social media, there's audience, people are listening. This is the way people are listening nowadays. So despite some of the negative usages that we're seeing, I think we can say, I just don't want to deal with this. That's a mistake, because it will be dominated by negative voices. So the more we can do, either to promote conversation, to promote action, to promote kind of the positive actions we're looking for, we know we can reach more people. So all in all, I see this as a tool that we have to be smart in the way we're using to promote our agenda.
And that's why I appreciate this conversation, because this is a way to address that. And by the way, when we leave this conversation, I ask everyone to then have this conversation with somebody else, right, and amplify that. And that's the organic way I think we overcome this. To wrap things up, Commissioner, same question to you. Social media, how have you seen it play a role in this moment?
A lot of the things that everyone has already said, there's a way in which social media really kind of democratizes all of us, and people are able to get information, like what Christina was saying, in community. It's so easy to contact people, spread information, and get other people kind of mobilized very easily. What I always find very challenging, though, about social media is there's a way in which the idea of accountability becomes very intangible, right? Because social media is so easy to use, because people can, you could set off like 50 tweets in whatever period of time. the sense of accountability that people feel, the weight of some of the things that people say, you know, they don't feel it as much. It's this intangible medium for some people. And there's a lot of hurt that also gets conveyed, you know, in that space. So, you know, so that is a concern. And then just, you know, a lot of the things that everyone else has said. I will say, Cefaan, you have not yet asked what I think is like one of the most important questions for this group, which is, you know, what are people's favorite ice cream flavors? Chinatown ice cream. I thought that was going to be one of our first questions. And I'm always happy to volunteer my response. I don't know if Christina remembers, but I am almost, what did you say, Christina?
Was it almond cookie?
No, I always have to go red bean.
Red beans. That was my second.
That's a good one.
Have to go
That's a good
red
one.
bean.
Yeah.
You know, I saved that for you to ask last because like a newscast, you have to start heavy and end light, right? We need to end with hope. So that's a good place to end. We're a little over time, but I do appreciate everyone taking, again, more than an hour when it's gorgeous outside to have this conversation. It really is important. Now, I'll end with my personal sort of feeling on this. When I'm often asked where we go from here, I always say what we do from here is we keep doing this. We keep speaking out. We normalize speaking out, right? Because if we don't speak out, then this issue doesn't ever get addressed. Look, we may never resolve this overnight or in a lifetime, but we can't accept it as okay. And I think that is where we start. And so that is why this conversation is so important. It is an awakening. And I think that's the way to look at this. That's the hopeful way. So hopefully everyone who joined us is a little more awakened. And I, again, plead with you all to have this conversation with somebody else so that we can amplify, you know, all the good that is still left to be done and is happening. So again, thank you everyone to this awesome heavy hitter panel. It was a really thoughtful discussion. And if anything, I think this will be also available to watch somewhere on Facebook, right? We'll share that. And again, thank you so much. Let's celebrate. There's not a whole lot left of AAPI Heritage Month. It's May, but you know what? We can do this every month. Why make it 1 month, right? So thank you, everyone. Enjoy the day. Be safe, be well. Appreciate your time. Thank you.
Thank you.